Today I am going to talk about a problem that is called anemia, low hemoglobin, which is one of the most common problem in our society, whether it is a young boy or elderly person or a middle-aged person. The common symptoms of anemia is patient or the person become breathless, not able to focus on his activities, breathlessness on exertion, not able to fly the stairs. So these are the common symptoms of anemia. And whenever a person develops this kind of symptom, one should get investigated for the cause. And the most common test by which we diagnose anemia is complete blood count. The complete blood count consists of hemoglobin, WBC, and platelet. So hemoglobin, so normal persons would have a hemoglobin of more than 12.5, and anything less than 12.5 we call it as anemia. WBC count ranges from 4,000 to 7,000, and platelet ranges from 250,000 to 450,000. So whenever hemoglobin drops, you develop anemia, you should see your physician, because anemia can be a symptoms of various diseases. The most common cause of anemia is in our society is nutritional. So to formation of hemoglobin, we require iron, B12, folic acids. So whenever there is a deficiency, it causes anemia. So that is called nutritional anemia. And the source by which the patient develop this kind of deficiency, if they are not taking the diet properly, or the stomach or the patient is eating unhealthy diet, because of that worm manifestation has happened, that can cause GI loss and loss of nutritional supplements, which is responsible for formation of blood. So this is one of the most common cause. So whenever the patient comes, we investigate these three possibilities. When we check that no, all these nutritional supplements are normal, still patient is not forming proper hemoglobin, then we need additional investigation. So it can be genetic or non-genetic, or sometimes some defect inside the bone marrow. So in genetic, the most common causes of anemias are thalassemia, which generally happens in a younger age group, that is less than 1 year or 1 to 5 years. So whenever we see a patient in a childhood with anemia, we first rule out nutritional, and then if that is negative, then we do the genetic testing why this is happening, and many cases we find that the patient is having thalassemia like diseases. And a very simple blood test that is to be done to diagnose this case is hemoglobin electrophoresis, by which you can diagnose thalassemia. Some rare causes like or dreaded complications of diseases which can present first as anemia is like leukemia, blood cancer, myeloma, sometimes lymphoma. Sometimes chronic diseases also can present simply just like anemia, and when we investigate, then we come across that the patient is suffering from this disease. So anemia is a symptom, it is not a disease. It is a symptoms and sign of an underlying disease inside a person. So whenever we come across an anemia, or you come across that you are suffering from anemia, one should get properly investigated why this anemia is happening, and based on the etiology you should treat that also, and not only by taking just iron tablet, vitamin tablets and correcting the anemia. So proper investigation is very, very important, and by that you can pick up lot of diseases which gets into a which takes a complicated shape if not diagnosed properly. So once symptoms of anemia happens, one important test that is required is to do a complete blood count, and after that report you should talk to your physician and get yourself investigated. Thank you very much.